Welcome to another episode of In Office. I am Dr. Jevon. Today we'll be discussing pregnancy and antenatal care, and with me in office today is a young professional. Her name is Nurse Litman. Right. Welcome to the show. Alright. So before I get into the show, I just want to give a disclaimer that this show is basically an information-based show for academic purposes and should not substitute any form of diagnosis or prevent you from visiting your health professional. Alright? So pregnancy is normally divided into three different trimesters. So we have the first trimester, the second trimester, and the third trimester. Right? And pregnancy is normally up to about 40 weeks. So just divide that into three and we'll get the different trimesters. Now, antenatal care is essential for a healthy pregnancy and also to prevent death of the baby. Now in Jamaica and in most clinics in the world, we have the antenatal visit is normally done by gynecologists or sometimes by midwives initially. However, we normally recommend that they visit like for the first, so as soon as the patient discovers that she is pregnant, we normally encourage them to seek medical attention at that point, right? At the first visit, we'll normally check for certain issues such as they do blood tests, such as the blood count, just for HIV, just for syphilis, rubella, and the blood type, and some persons do sickle cell as well, right? So in addition to the different blood works, we normally do urine tests, which we check for protein, and also we examine the patient and also to do a detailed history in terms of the medical history, such as whether the person have diabetes, hypertension, any form of cancer, any form of chronic infection such as HIV, and to check their BMI to check if they are overweight or underweight. And also the age is important in this case, whether they are teenage pregnancy or what we call advanced maternal age, which is greater than 35. Because sometimes these patients are high risk pregnancy, and so we need to gather all those information from the first visit. So from the first visit, it's now recommended that from the first visit up to about weeks 28, we see the doctor once per month for a regular checkup to check the vitals, check the urine, etc., and to make note of the progress of the pregnancy. From weeks 28 to 36, we normally go twice per month. So that is every 2 weeks. And then from 36 until the time of delivery, normally should get a weekly monitoring by the doctor. Now, we normally do an ultrasound in the first trimester, and this is a dating ultrasound. Alright? And this will help guide the expected date of delivery and to tell whether it is a single fetus or twin or etc. Right? And at this point, we'll also do the necessary counseling and also recommend the prenatal vitamins and to discuss about diet, etc. Now, for the second ultrasound is normally called an anomaly scan, and that ultrasound is normally done between 18 and 22 weeks. It varies from institution to institution and recommendation. However, the anomaly scan is normally the scan to check for any fetal abnormality, such as neural tube defect, also check on the size of the fetus and any other anatomical abnormality that the fetus might have. Alright? In terms of the antenatal visit, it's essential because it reduces the risk of complications during pregnancy and also both the death of the mother and the child. Right? So it's very essential that you should all get medical attention as soon as they discover that they are pregnant and ensure that they follow the doctor's instruction to the T. Alright, but with no further ado, let's start the discussion with Nurse Litman. Welcome to the show once more.
Thank you for having me.
Okay, alright. Now, young professional and you're pregnant, seems that you have to be out there every day, right? So you have basically going to work every day. So it's not like you're a stay-home mom, alright? So it's a little more challenging for a professional that is pregnant, alright? But before we get into the social aspect of the pregnancy, let's just discuss initially, like when you found out that you were pregnant, what are some of the symptoms that you were having?
Alright, so basically with me, when I found out that I was pregnant, I contacted some persons to find out what I should do. I noted that with my schedule, I won't be able to go to the health center, so I had to find either an OBGYN or go to just a general practitioner.
Okay.
So, at first I didn't have any symptoms whatsoever, like nausea or vomiting, anything like that. So, I visited my doctor to confirm the pregnancy, even though it tested positive and
Pregnancy test was positive.
yes.
Okay.
So I wanted to get a professional overview as to how do I go about doing things, because it's my first time, so I didn't know what to do.
First
So,
test, you're nervous.
yes, very nervous, but I had my family support and friends and my husband as well, so
Okay.
it was that challenging.
Alright, so you have your husband supporting and family, so you are fortunate, alright? No, so, but in terms of, so after you had positive pregnancy test, what are some of the symptoms you had during the first trimester, so the first 3 months thereabout? No, there was no vomiting?
There was I had no symptom whatsoever.
Whatsoever?
Nothing. So even when I found out that I was I think it was 4 weeks late,
4 weeks.
I had no symptom whatsoever. I was just going about my day to day, no challenges. So I'm the fortunate one.
So what had prompted to do a pregnancy test? You had missed the period?
Yes, so I used the flow calendar, which tracks my period, and I was wondering, I got it late again.
Yeah.
So I tracked it and I said, no man, I have to do a pregnancy test, because at first I did it, but it showed negative. So I said, I'm gonna try it again, and that one showed positive. So when I came back to work now, I contacted my colleague at A&E,
Yes.
and I asked her for another ACG test.
Yes.
So she did that, and it came back positive as well. So I was sure that I was pregnant.
Okay. So you felt that time when you found out that you were pregnant?
Well,
You're happy and excited that you're trying, or?
I was very nervous because I didn't know what to do at this point, because yes, am I ready for a pregnancy? And then I said, I have to be pregnant at this point.
You have to get ready. Right?
Yes.
So for the first visit that you went to the gynecologist, what were some of the things that the gynecologist did at that visit?
Alright, so for my first visit, I didn't go to the OBGYN at that time. I went to a general practitioner
First.
and he scheduled me to do a full body scan with the urine test, with the glucose, everything. He suggested that I was supposed to do a blood test. I don't remember in what particular week I did a blood test, but he recommended that I do a blood test. And at that point, also it showed that I had some, I think my protein was a little bit elevated.
But from the urine, from the
Yes.
lipsticks? Okay.
So he suggested I did a 9-panel urine test to determine if there was anything abnormal, anything like that. But in particular,
Normal.
most of it. But there was one bacteria, so he recommended I got some antibiotics.
Okay.
But that was just the
Alright, so what are some of the blood tests that they did? They did the blood count, the
yes, we did a full
HIV.
CBC with the blood type.
Yes.
We checked for sickle cell,
Yes.
rubella, syphilis, and all those things. Yeah.
Okay. And so after this first visit, how long after you had the ultrasound? For the dating ultrasound?
The dating ultrasound, I think I did it at 13 weeks.
13 weeks?
13 weeks, and I was told, well, at that point, I said I maybe need an OBGYN to kind of did a better examination, because there was a general practitioner. I needed some professional point of view into that aspect. So I changed it, and I got my first EDD, so expected due date.
Yes. Alright. And so you have been following, since then you have been following every month. Alright, so you've been getting your monthly checkup. So what are some of the things that they do in the first trimester at those monthly visits?
Alright, so those, as I said, the urine test, the glucose, ensure they check those every visit.
Every
And
visit.
your weight, ensure that your weight is not deviating too far or anything like that. Ask if you're experiencing any symptoms, which I wasn't.
Lucky, they said you need to take any medication, so no pain, no vomiting.
No.
Alright, you're blessed, you're lucky, right?
So I did not take anything like that, which I was thankful for that.
Alright. Now moving to the second trimester when you start to go like every 2 times per month. Alright. What are some of the difference that by then they should be start to use the Doppler, listen to the baby heart?
Yes. I was so excited because at first I got to hear the heart sound. So I kind of got real confirmation that yes, there was a baby inside. And even though I'm a preemie, I got my first quickening at 16 weeks.
Okay.
So it felt like a gas
Yeah.
but I know that it was the baby.
Okay, so it's from 16. Normally it's like for the second time mom saying to feel it.
So I feel it late.
Alright.
And I did the anomaly scan at 20 weeks, which showed that baby was growing.
So the gender reveal already? You know, the gender.
The doctor, when I went to my gynae, she worked it out, so so I didn't need to do any more gender reveal. She didn't. Well, she thought.
Should you keep it private?
No, she thought that she thought that I had knew what the gender was, but
Okay, so it didn't get a chance of it.
cool.
Okay, alright. No. So you got the ultrasound and said confirm. So I didn't believe that before the ultrasound with the heartbeat, they didn't believe the previous ultrasound which just detected pregnancy.
At that time it was so small and so squiggly. So yeah, I did confirm it at that point, but seeing the way we move on the ultrasound and everything like that, that was a true depiction of what it was happening actually. So
you got one of those three-dimensional ultrasound?
no.
When she had the photographic, no, I didn't get that one. Alright. No, so in terms of the follow-up, they start to measure the fundal height because normally they measure so they start from the pubic symphysis to the top of the fundus, that's the highest point and the womb, and it normally from about 20 weeks we should be matched, that measurement in centimeters should actually be matching up with the number of weeks pregnancy.
So it has.
It has. The fundal height measurements, they didn't have any deviation apart from your weeks normal match up to the fundal height that they measure centimeter. Alright? Now, so apart from the urine test measuring the fundal height, did they do any pap smear?
She didn't do a pap smear, but she did a vaginal examination, and while doing the ultrasound also they check if the cervix is intact.
Okay.
Ensure so that it's okay, because I remember in the second trimester I was feeling some pressure on my pelvic area, so I was wondering what was happening. So I had an emergency visit with her.
Yes.
And she stated that I was dehydrated, so had to be. So she recommended that I drink a lot of water. I got 1 liter, 0.9.
Okay.
Yeah, so that kind of relieved the pressure of what was happening.
Okay, so apart from the pain, what are some of the other second trimester symptoms that you're having?
Second trimester, I had a swollen feet.
That are swollen feet.
But I still didn't have any nausea and vomiting. As the baby advances, there is somewhat back pain.
Back pain.
But it's mostly like if I do work a lot on the ward, like extended hours, or I bend a certain way. So
In the back pain.
yes.
Alright. And so what about like in terms of stretch mark? I know this one is stuff that females tend to scare, disappointed when they're pregnant and the beautiful skin now have stretch mark. You don't have any issues and
No, I don't have any stretch marks.
what are some of the products that they use to prevent that?
So
You can share with the people.
my sister recommended I use the baby oil, and I've been using it from a bit. My tummy started to advance, and I started using a collagen cream. I don't remember the exact name of it, but I started rub those both on morning and in the afternoon. So no stretch mark.
No stretch mark. All right. Thank God. Hope it stays that way. All right. And so now I guess we can move over into the third trimester. So you confirmed that the pregnancy was there with the ultrasound. You get the expected date of delivery. You got the anomaly scan and the baby was fine as usual. And you get like instruction to count like the amount of movements per day or.
I haven't as yet. Hopefully my next visit will instruct me on how to do that.
Okay. Now they are in the third trimester, all right? I hope.
Yes.
Yes, alright. So that's one of the differences that they're having in this final phase now.
Alright, so in the third trimester, the weight of the baby is very evident. So I tend to have a little bit pressure in, especially when it comes down to the latter hours of the day. I still have a swollen feet, so I have to keep that elevated. The back pain is, but it's mostly unilateral, so mostly to the right side. I don't see the baby more gravitating to that side, so I think that's why it's causing so much pain.
Okay.
Other than that, that's basically most of what I'm experiencing now.
Okay, alright. And the second set of blood work, so normally we do you have done the second set of blood work. Normally we repeat the HIV, the syphilis, sometimes the blood count. Probably just the blood type and I guess the sickle would not need to repeat, alright? And what about we normally test for gestational diabetes as well. Despite that we test the urine for the glucose, we normally do a formal glucose oral tolerance test. Have you done that as yet?
Yes, so I was recommended to do it during my 26th week.
26th week,
Yeah,
I did
26th week I did it. I did the 1 hour glucose tolerance test.
Yes.
It came back a little bit narrow today when I said to borderline.
Yes.
So I was told to do the 2 hours one.
Okay.
And it came back normal.
Normal?
Yes,
Okay.
so I'm putting that last week.
Alright. So now let's probably get into some social aspect. I know that you're pregnant, you're a professional, you're a nurse, you're basically on this at work every day. Some of the comments that persons make about you.
Mostly when I'm at work, because I'm at the clinical side now. So the med surgical nurse would like see me and like, where you're getting so big, and it's like, where were you? It's like you're at far now and things. But I don't get persons that are saying that I don't look too pregnant because I don't have the nose and the pregnancy color that darkens your skin. But
the pregnancy fitted.
yes, that's mostly what I was told.
Alright, well I mean that's good. Some its advantages like you get in terms of they always give you a skip or if you're in the line.
Yes.
Going like in the food line, they would put it at the front.
Yes, I have to say, because the taste is when I went to the Cargill location, the persons that serves the parties and so on, they told us that pregnant women don't join the line. We normally push them forward because we're advanced, so they tend to look after you. So I said pick up the tasties on that.
Okay. And so what about in terms of your colleagues at work? They look out for you as well?
Yes. Especially on the med surgical floor, they will say like, we're doing this ward, it's too heavy, and so they will tend to, give the more stable patient, although if, sometimes they don't have the staff, so they will ask you to assist and so on. And they will make you like, lessen your workload, maybe they do your vitals for you or take out your medications. So I do have that assistance and I thank those groups.
Okay. So what are some of the negative comments or bad comments that person make? Because sometimes some persons get real upset. Sometimes, it's Jamaica, so sometimes persons not always polite in their comments. What are some of the negative comments that
they receive much, but however, when you're on the ward and even though you're a registered nurse, you're expected to do what the registered nurse are supposed to do. No one cares if you're pregnant or not. So some persons oversee that and don't care about that. So I don't think that's the only negative side I've received so far, but it's mostly good comments. So
the good comments.
Yes.
Alright, that means you don't have not have about that. So if I don't mind, what are some of the different changes that occur at home since you're pregnant?
Well, basically, there's not much changes. Other than, you're expected to know a lot about pregnancy because you're a nurse, quote unquote. But it's my first time, so I'm still learning. I still go to some of the traditional routes, but I do take the health, the knowledge based on the nurses I've encountered or my family's experience in regards to the childbearing aspect. So there's not much changes, which I'm so happy about.
So when is the baby shower? Soon. I know you always do baby shower at work, so private baby shower.
Well, when you're isolated in a section, no one remembers you.
Okay, so
hopefully they will bless me soon.
So what about photo shoot? Did you photo shoot already?
I'm expected to do my maternity photo shoot December 22nd, so it's close to Christmas.
Alright.
Yeah.
All the best with that, alright?
Thank you.
And in terms of advice from you, what are some of the advice that your sister, your mom would give you, or other nurses? Give us some examples.
Especially the physiotherapist. I saw her yesterday. She recommended I do some squats to kind of help with the pelvic aspect in the childbearing, and to continue doing sexual activity. So, and my midwife sister, which is my child nurse, she recommended that once you're going into the labor and delivery, you listen keenly to your nurses and doctors and follow the instructions keenly. And if you don't, you might get teary, which I don't want because it's my first time. And other than that, they said try to stay positive, don't cry a lot because you don't want to cry baby, and not to stress out yourself.
Alright. So in terms of the advice you're getting, I think you're all valid advice.
Yes. So I'm doing my research and I'm trying to watch a lot of videos and preparing myself, preparing the mind, because as you say, finally reach adulthood. If you don't have a child,
oh yeah.
Yes, so
oh yeah, really adult now.
Yes, really adult.
You're not just thinking about yourself.
Yes.
Alright, good, alright. If you like any tips about labor, like what to expect during labor, are the gynecologists about
she haven't at that point in time. So mostly I'm researching, but we're recommended to do the booking. So the doctor has requested that we choose, since it's private, they choose a hospital that you like to go. And I chose the Victoria Jubilee Hospital. Since I'm in close proximity, so anything happens, we'll just go over there. And they have given me a follow-up date that is close to my due date, and recommended that I continue to follow up with my AG1.
Okay. Alright, so I'm glad you mentioned because you're a young professional, and normally young professionals tend to go privately, but you plan to come in the public setting. What were some of the factors that made that decision apart from the close proximity?
Alright, so with Victoria Jubilee, they are the main points in regards to childbearing. So if any serious case or anything happens in those private settings, you're expected to either they take over your case or anything like that. Why not just go to the head that deals with all of these conditions, your staff? So it's a win-win.
Alright. But any final word for the viewers about persons that may be pregnant or are planning to get pregnant? Any final words for them?
What I recommend is that once you find out that you're pregnant, is good to start your checkup, do your prenatal visit early as possible so you can know what's happening, Speak truly as to what is happening to you. Let the doctor know. So don't hide anything because in the long run, your fetus is at risk. I do recommend that persons perform their ultrasound even though it's costly. It's better to be in the know than to be sorry later. Do recommend you take your prenatals as recommended. If not, if you can afford it, then ask for alternatives that can assist you. Do take recommendations from persons who have went through it, and just stay happy, healthy. Even though it wasn't planned, the pregnancy wasn't planned, still try to make the best of it because you don't know what this child might be in the future, and we are all here for a purpose. God never put you on this earth to be a menace, but be the light at the end of the road for this child, and just stay positive.
Okay, Nurse Litman, well said. All right, I must commend you for that. And you did well, so hopefully when we have a next session on breastfeeding, you'll volunteer to come and share with the world your experience breastfeeding as well, all right?
Yes.
So remember, viewers, for more informative medical content and life, sickness and death, kindly subscribe, share, and leave a comment. And you can actually, in the comment section, you can actually just share your experience or any advice that you have for Nurse Litman or any other person out there that might be having, maybe pregnant now and going through different issues. So until next time, take care.
Be sure to subscribe for more informative contents on life, sickness, and death.